This is to answer the question, tea and coffee not connected with the kidney failure, but only with stones, some type of stones.
Yeah, thank you, sir. Mr. Abhilash Nair is asking, is excessive water intake is acceptable?
Excessive water to some extent is not good because it can dilute your sodium inside and you can develop low sodium. What is recommended is around 3 liters of fluid. You go up to 4, 5, no problem. But if you go on compulsive drinking, these are the people who develop psychogenic say dependence on the drinking of the water. And second, too much of water without salt can produce low sodium. These are all very rare cases. We have enough reserve of sodium and everything, so body can adjust and readjust in such a way that the blood biochemistry can be maintained. Kidney also will adjust accordingly by contributing or preserving the sodium so that the milieu interior, the blood biochemistry will be maintained. But to answer your question, too much of water, is it healthy? No.
Thank you, sir. Mr. Riaz is asking about diet. He's asking about the keto diet, high-fat diet. Is it harmful to the kidney? Can I drink more water? Will it be compensate my high-fat diet? That is his question.
To answer, if you have a good, healthy kidney, it can handle any amount of protein or fat. If a failing kidney is there, it won't be able to handle protein, and your creatinine and urea will increase. And all this diet contains, I understand they contain sodium or salt more, and they all imbibe water more. So if you have a healthy kidney, it can handle all. So 1 gram of protein and 1 gram of starch will give rise to 4 calories, and the protein is preferred than starch for diabetic patients if you have good kidney function. So if you have ultimately it boils down to do you have a good kidney or bad kidney? If it's a good kidney, it will handle all these things.
Yeah, Mr. Alvin and Gigi are asking about the precautions to prevent the kidney stones.
Yes, basically you must take 3 liters of fluid. If you have a family history of kidney stone, you must anticipate that you are going to get. If you have a stone, try to get the stone if passed or if removed. And if not removable or not to be removed and not passed out, then you go for an X-ray. If is it seen in the X-ray or is it not seen in the X-ray, called radio opaque. The stone produces the shadow in the X-ray. That is a calcium stone. Otherwise, it's a uric acid stone. Then we can estimate the content of the urine. 24 hours urine collection from morning 6 a.m. to next day 6 a.m. And you look for calcium, uric acid, oxalate, and you can, if this is excreted more, then you have to deploy dietary measures and medications in such a manner that your urine is not super saturated for the stone forming elements. Then we go back to our physics, any stone or a crystal grows in a super saturated. So you have to undersaturate it. That's the whole principle.
Sir, another question from Mr. George. He's asking, is there any life period for the transplanted kidney? And also he's asking, is high kidney transplantation expenses are realistic? I don't know, maybe this is out of our...
there is no time schedule or period for a transplanted kidney. Like your tire. For example, if you put your tire, you say you go for 50,000, so many factors. Who is the donor? How much is the acceptance? What is the medications? Which surgeon did? Who is looking after? Are you compliant with the medication? Do you have diabetes, pressure, comorbid conditions, rejection episode, etc.? When I started transplantation, 8 years was okay. 7 to 8 years was okay, and most of people will come for second transplant. Nowadays, people are reaching up to 15, 20 years because newer immunosuppressive medications are there. Surgeons have become more experienced, and newer this immunosuppressive medication. So to answer your question, there is no shelf life for a kidney. And if the first one fails, you do the second one, third one. Like that, we have done up to even 3 in a couple of patients, at least half a dozen patients. So that is okay. And what is the cost? It depends again on center to center. At Lakeshore, in my unit, it come to around 11 to 12 lakhs for the surgery, irrespective of who is the donor. Father, mother, wife, or husband, or children, any or unrelated or cadaver, all this will come under a blanket expense. There is no package by the hospital, but when they go, we ask them how much you have. Last person who went last week told me it is around 11 lakhs from the time of admission to the time of discharge for the donor and the recipient. But story doesn't end there. You have to identify a donor. You have to do all the tests. You have to get all the certificates. There are costs involved in that. You have to be on dialysis 3 times a week till transplant from the time it is there. And then once you are discharged, story doesn't end there also. Lifelong medication, at least 10,000, 12,000 rupees, depends on your body weight. So it is an expensive thing. But my successful transplantation is better than being on dialysis. That is one. 2, you have to work hard to make. So most of the NRIs, we tell them, you go back and work. What can you do in Kerala? So you go back and then we attach them to the treating nephrologist, or they may have medical reimbursement, etc. Kuwait, a couple of people are my friends in the ministry, and so I entrust all to Dr. Prasad. We were together in Trivandrum. Some of you may know him. Dr. Johnny, our chairman, was there for some time. Narayanan Namburi was there. He is no more with us. So all these people were in Kuwait because I'm doing a lot of work in Kuwait. And so all our patients after transplant will go back to Kuwait and be under Prasad now.
Dr. Namburi was the founder president of Indian Doctors Forum in Kuwait.
Yeah, correct. We lost it.
Doctor, there is any relation between prostate enlargement and kidney disease? This question asked by Mr. Ashraf.
Can you please repeat that?
A relation between prostate enlargement and kidney problems.
Prostate enlargement. Yes, it is a very interesting question. Answer is yes, but no. Prostate gland does not produce much symptom initially. Say we all have prostate, all men have prostate. So like ladies have got menopause, men above the age of 50 will develop prostatic enlargement, which is called benign prostatic enlargement, BPH. Out of the 100 people having prostatic enlargement, 2% will have cancer, prostatic cancer. So early detection of prostatic cancer is by doing a PSA screening, prostate specific antigen. The importance of identifying prostatic cancer is that once it spreads the capsule, metastasis, it will spread to bone, and then life becomes very difficult and miserable. Whereas on the other hand, if it has not spread above the capsule or outside the capsule, it is a totally controllable and containable disease. So that is my comment about prostatic cancer. That was not the question. So when the prostate increases in size, it interferes with the flow of urine from the urinary bladder outside. Initially will be hesitancy, then in the stream will be less. Then you have to wait for some time. Then finally, too many times it will go, dysuria. All these are signs of prostatic enlargement. There are medications, 2 medications are there, A and B in combination, A plus B. You can control up to 30% shrinking of the prostate. In spite of this medication, see if your ultrasound shows that prostate is big enough and the bladder is retaining more than 50 ml, going on above 100 ml, then it produces back pressure into the kidney and kidney failure can come. And when you correct it and drain the urine by putting in a catheter or by prostatic removal, by removal of the prostate without surgery through the urethra, it is called TURP, transurethral prostatic removal, TURP, resection of prostate. So then it will revert back. But once it is more than 3 months, going on for a long time, permanent damages will come in the kidney. So to answer your question, can prostate produce kidney failure? Answer is yes, by preventing the flow of urine. And that is at a very advanced stage in the elderly people and not neglected, etc. Okay.
Thank you, sir. Thank you. So one more question from Mr. Santosh. He's asking about, he's a normal person above 50 years. Urine microalbumin screening, how frequent is recommended?
Well, above the age of 50, you have to look annually at any kidney problem along with your cholesterol and sugar, etc. But microalbumin in particular, if you're a diabetic, annually should be okay. You do it 6 months,
okay.
no problem.
Another question from Mr. Krishnamurthy. He's asking about if a normal two-born baby with one kidney, does this baby can survive normal for the entire life with one kidney?
Can you please repeat, Rajesh? I didn't read.
If a baby born with one kidney, does this baby can survive normal for the entire life with one kidney?
Answer is yes, if that kidney is normal. 1 in 200 people are born with only one kidney. Many people donate, like our father Chiramel and Kochi said, they have only one kidney. So either, and many people have received one kidney when their 2 kidneys are born. They have 3 kidneys, but functioning kidney is only 1. So our Anju Bobby, our Olympian, has also one kidney only. She found out only when she came to us some time back. So these are all compatible with life. The whole point is that kidney should be normal. It is compatible with life. You can live. And many medical disease, whether you have 1 kidney or 2 kidneys, it affects the same way. So life is very much compatible. Your sexual activity, your memory, your growth, everything is normal. That kidney will compensate and hypertrophy. And it will give rise to around 70% of both kidneys working together in few months to few years.
So another question from this is like, are cholesterol medicines and aspirin are harmful to the kidneys? This is a very significant question nowadays, I think.
Cholesterol medicine per se is not harmful to the kidney. Second, aspirin. There are many people who believe that aspirin is safe in kidney. There are many nephrologists who believe that aspirin is safer in kidney. But I am of the strongest opinion that aspirin is not safe to the kidney, even in small amounts, because we have seen many elderly people, compromise people on small doses of aspirin worsening, and when you stop, they are coming back. So I recommend that it should be substituted with other equivalent antiplatelet medications like clopidogrel, etc., as possible. But there are conditions where, like multiple stents, where again I come back to the point that heart is important than the kidney. Okay, kidney goes, you have dialysis and transplantation, but if the heart goes, what can you do? So small dose of aspirin with clopidogrel, but we still clip them for the use of bigger dose of 150 milligram aspirin. Aspirin, not only that, it irritates stomach and produces bleeding from the gut also. There are urinary kidney failure patients who come with bleeding from gut, and it's a nuisance. So I am of the strongest opinion that it should be avoided to the maximum in kidney failure patients and should be substituted with other equivalent medication like clopidogrel, unless and until the cardiologist says that yes, it is going to save his heart.
Sir, one more question from Mr. Joseph Padika. He's asking about the eating habit of papadam, 6 number or more for in a day for athletes. Yeah. What is your opinion related to kidney disease and papadam eating?
Papadam became very popular recently because in a marriage function, for not being served papadam, there was a fight and all. So papadam, whenever is told, we refer to that. Papadam contains a lot of salt. papad and pickles. So that is the only thing. Otherwise, and Guruvayur papadam is the best papadam in this area.
Really. He has another question regarding his medication about trigeminal neuralgia and epileptic patients. They are using carbamazepine and baclofen for lifelong for neurological conditions.
Diclofan is our enemy.
Baclofen.
Baclofen is for hiccup and other things, neurological medicine, both the same. Baclofen produces a lot of sedation. See, you take baclofen, one tablet, you may sleep for 3 hours. The CKD patient, kidney failure patient takes it, you will sleep for 1 full day. So we give small doses. We use it for mainly hiccup, baclofen, and the other one, carbamazepine. They are all safe, from kidney problem, no issues. Only thing, they should be using it judiciously from the side effect point of view, sedation.
Sir, next, I am concluding with one more question. This is by one lady, his name is Manju. She's asking the question in Malayalam actually. എനിക്കിപ്പോൾ 41 വയസ്സായി 25 വയസ്സിൽ നെഫ്രോട്ടിക് സിൻഡ്രോം ഡയഗ്നോസ് ചെയ്തു 3 തവണ റിലാപ്സ് വന്നു സൈക്ലോസ്പോറിൻ 5 വർഷം കഴിച്ചിരുന്നു പിന്നീടുള്ള 5 വർഷം മെഡിസിൻ ഒന്നും കഴിച്ചിരുന്നില്ല റിലാപ്സ് വീണ്ടും വന്നപ്പോൾ ബയോപ്സി എടുത്തു മിനിമൽ ചേഞ്ചിങ് ഡിസീസ് തന്നെയാണ് എന്ന് ഡോക്ടർ പറഞ്ഞു 4 വർഷം മൈക്രോഫ്തിനൈറ്റ് സോഡിയം കഴിച്ചിരുന്നു 2 വർഷം കാൻഡിസാറ്റാൻ കഴിച്ചിരുന്നു ഇപ്പോൾ omega-3 ഫാറ്റി ആസിഡ് മാത്രമാണ് കഴിക്കുന്നത് യൂറിൻ ക്രിയാറ്റിൻ ക്ലിയറൻസ് നോർമൽ ആണ് ഈ സപ്ലിമെന്റ് മാത്രം മതിയോ വേറെ സിംറ്റംസ് ഒന്നുമില്ല
Manju, I got it. Manju, the urine creatinine protein ratio clearance. Anyway, coming back to your question, if you are fine, if your urine is not showing protein, you are disease free. But how long? Nobody can say. You can get relapse. This is the best disease in the kidney spectrum. Minimal change, nephrotic. Protein leakage coming, swelling of the body, and high cholesterol. You take treatment, it responds, melts like ice. You are very fortunate that disease went off. You took MMF. Then now 2 years you are taking only candidates. So you check your urine, protein creatinine ratio, or 24 hours urine for protein. If either of them are normal, you don't need to take any medication. But you keep on checking. This can come at any time. Usually it is a disease of the children. And once they become adolescent, this is not seen. But I understand that you are now 41 and this started at the age of 25. So you have to watch for it. Anytime you put on weight, your routine random checking of urine shows albumin, you consult your doctor and take one of those medications, it will come down again. So you are very lucky that you have a nephrotic syndrome, a disease in the kidney which is good for you and good is supposed to be good, and you have your kidneys have responded to the treatment, and now you are symptom free and disease free, as I understand, if this is protein creatinine ratio. So should I take omega-3 fatty acid? That is one of your questions. Answer is no. Omega fatty acid is just fish oil, and it was being used in the many years back when we had nothing. So a lot of omega fatty acid had been used, but nowadays we don't use it. So you relax, you enjoy your life, check your urine for protein leakage, whether relapse or the nephrotic comes. If it comes, you go back to your old doctor or any nephrologist and they will give you medication. Okay?
Sir, if you don't mind, can I ask one more question?
Surely, it's your time.
Thank you, sir. Does low carbohydrate diet affect healthy kidney? Mr. Joyce Peter has this question. Actually, I missed this.
Answer is no. Carbohydrate has nothing to do.
Okay, sir. Thank you so much. And over to you, Prashant. I think I have, even though I cannot go for all the questions, but I compiled the questions and nearly completed. Thank you so much, and over to you, Prashant.
Thank you, Rajesh.
Thank you, Dr. Rajesh. I think we have extended the session by more than 30 minutes as of now. Moving on to the official task of vote of thanks. Thank you. Good evening, everyone. On behalf of PPF Kuwait, I would like to extend a heartfelt vote of thanks to each and every one of you for joining us this seminar. We are truly grateful that for your presence and active engagement that we could judge from the number of questions that we got throughout your session. Your valuable participation has made this event a fantastic success. Over 100+ participants have raised questions that we have successfully grouped together. Dr. Rajesh and his team, the PPF team, has grouped together and raised it in the shortest concise time possible. I'd also like to take this opportunity to thank our speaker, Dr. Georgy, for sharing his valuable experience, time, and insights with us. Your talk has been invaluable, sir. Thank you very much. Our team has worked hard to make this webinar happen, and we are glad that it was able to provide valuable information to all of you. Thank you to all the members, friends, and well-wishers of PPF Kuwait behind this event. Once again, thank you all for joining us, and I hope we will see you in our future events. Have a great evening. We would be concluding this in another, we will be closely stopping the window. Thank you once again, all the participants. Thank you, Dr. Georgy. Thank you very much.
Welcome.